our guest for the talk, and I'd like to give a brief profile of our guest. So our guest is a dietitian. She has over a decade experience working with people living with chronic diseases, kidney diseases. She started her career at the Kolebu Teaching Hospital, and now she works at the Bank Hospital. At the Kolebu Teaching Hospital, she was the pioneer dietitian there and has moved to the Bank Hospital. Shall we welcome our registered dietitian, Ernestina Owusu, to take us through the talk. Before she comes, we will do about 1 hour talk, and then we'll open up the space for some discussions, and then we wrap up. RD Ernestina, if you're on the call, kindly take over.
Yeah, all right. Thank you so much. Before Aldi Ernestina comes in, which she will be joining us any moment from now, I would just want to reiterate some few things we need to take note of. Just as our moderator has said, this particular program is intended for the general public. And as part of activities to promote healthy eating and prevent the risks of chronic kidney disease, that is why this program was organized. So whilst our moderator is preparing to join, which she will be joining very soon, I would just like to take this opportunity to welcome all dietitians and all the people from the general public who have joined us this afternoon. And so we started this campaign at the beginning of the month, and the theme for the Nutrition Month was the role of diet in prevention of chronic kidney disease, make every bite count. So what we wanted to do was to create public awareness and ensure that whatever we are putting in our bodies should be should be things that will help promote the health of the kidneys. So we started with a doctor who came last week to talk to us about how we can to paint the picture about the global burden of CKD. And he took us through how the prevalence has increased over the past few years, which most of us didn't think was a problem. But currently, as we talk now, CKD is a big deal and we need to create this awareness. In one of the highlights of his presentations last 2 weeks, he mentioned that Kolebu receives over 400 cases of chronic kidney disease. And this is of concern because we have other centers that are also managing cases with CKD. So if Kolebu alone is recording 400 cases, it tells you about the number of cases we are receiving as a country as far as chronic kidney disease is concerned. And so he also with CKD, even the psychological fear and trauma alone can even cause you to lose your life because you are here thinking about the cost and how much you are going to incur in terms of the management. And so because of the cost of dialysis, many people are unable to afford the care. So if you don't have plans for dialysis, or if you can't have long-term dialysis or transplants, you are going to end up, losing your life. And so we believe that prevention is the ultimate. So the focus is how we can eat to prevent. Our resource person has joined us now. So I would like to bring the summary of what we had from the previous week and hand it over to Aldi Ernestina. Aldi Ernestina, you're welcome. Thank you.
Hello, RD Ernestina.
Yeah, hello, can you hear me?
Yes, RDS Celestina, you can
Okay,
kindly
I'm
go
so
on.
sorry. I was having some network challenges, and I'm happy that at least now you can hear me. Okay. So the topic I was given was the role of diet in preventing chronic kidney disease and trying to increase our understanding of nutritional strategies for kidney health, maintaining good kidney health. Okay. So, like our RD Marks explained that last week we had an in-depth explanation of what kidney disease is and the situation, current situation in Ghana, and why it is important that we all take it very seriously. So today I will try to tackle continue with where he left off. He did tackle some parts of the nutrition last week. So a little bit more on how we can eat well to prevent kidney disease. Okay. Okay. So the presentation will tackle the role of diet in CKD prevention and also tackle influences of diet on kidney health, nutritional strategies to prevent kidney disease, and diet kidney relationship and the dietary recommendations. Please, I hope everybody can hear me.
Yes, RD Celestina, you can
Okay.
kindly go
Okay.
on.
Thank you. Okay. So this is just a quick recap of what RD Max and the previous presenter from last week said. So we know that kidney disease is a long-term condition with gradual loss of kidney function. And we say somebody has chronic kidney disease when they have had the kidney disease for more than 3 months, sorry. Okay. And it is important because the prevalence worldwide has gone up and it affects millions of people. Its prevalence increases with increasing age that we can't do much about. Also, amongst people with diabetes, hypertension, the prevalence is higher, and also people with family history of kidney disease. Okay. Now, some of the things that kidney disease brings on will be the impact of on cardiovascular disease. So people have kidney disease, cardiovascular disease, they can get kidney disease. At the same time, when they have kidney disease, it increases their complications with cardiovascular diseases, anemia, bone disease, imbalances in electrolytes such as potassium, phosphorus, and sodium, and all that. And they may require dialysis, which you know is very expensive. And it also affects people in so many ways, like their quality of life. They have to spend money on medication. It's affecting their quality of life, causing affecting their physical health, emotional, and also causes financial burdens. Okay. So some of the preventative prevention strategies will be lifestyle changes. And without from last week, we heard that when somebody is obese or they are hypertensive or diabetic, it increases their risk. So to prevent it, it means that we have to look at ways in which we can use our diet and lifestyle to maintain a healthy weight and to maintain good blood pressure, to maintain good blood glucose levels, even if we have diabetes, and also how we can exercise, other risk factors like smoking, how we can quit that to make us prevent us from getting kidney disease, or even if we have kidney disease, make the outcome better. Okay. So, what are some of the importance of diet to chronic kidney disease prevention? Okay. So, we're saying that diet is one of those things that are modifiable risk, or that is a modifiable risk factor. So, some of the risk factors for kidney disease, we can't do much about it. As people grow older, their risk of developing kidney disease goes higher. That's you can become younger, so you'll be growing older, and the risk will be going up. But for things like diet, you can do something about it. So that is where it is very important. Now, when people have poor dietary habits, it increases their risks of the hypertension, diabetes, and obesity. And okay, people who also consume a lot of processed foods, foods that contain too much sodium or salt, or people who eat unhealthy fats, and we'll talk more about that. It increases their risk of non-communicable diseases, in particular kidney disease here. Okay, so when we have proper nutrition, even for people who have kidney disease, if they have proper nutrition, it can slow down their progression, slow down the need for dialysis or transplants later on in life. So it's something that we have to take seriously. Okay. So before we talk more about the diet, I want us to know some three key nutrients, four important food nutrients that are implicated in kidney disease management and also prevention. Okay, so the first one will be proteins. And the reason why I want to talk about these is that sometimes when we get people at the clinic, they will say that they heard that they have some kind of kidney impairment, maybe something small, or a family member has kidney disease and the person was educated on a low protein diet. So even though they don't have kidney disease, some of their strategies is to put themselves on a very low protein diet without knowing what amount they should take. So protein is something that is very important to us, and we'll talk more about protein. But when we talk about kidney disease, when you go online and you see the diet for kidney disease, it may be a low protein diet, but that's not the diet plan for somebody trying to prevent kidney disease. So don't intentionally put yourself on a low protein diet without consulting a nutritionist or a dietitian about it. It may not be necessary for you. Now, for everybody, we have the amount of protein that we should take. Most adults in Ghana may be taking that amount in excesses. So when it comes to see the dietitian because of risk factors for kidney disease, they may reduce your protein intake. That does not mean that they have put you on a low protein diet. That may be because you were taking it in excesses and they have brought you back to the normal portion. Now, for healthy people without any kidney disease, a diet that contains adequate protein is ideal. If you go a little bit on the excesses, it may not cause a problem. But if you have risk factor for kidney disease, or if you already have some kind of renal impairment, or you're hypertensive or diabetic, excessive intake of protein can also increase your risk of kidney disease. So it's important that we know how much we should take. The other important nutrient will be mineral, that's sodium. So sodium is something that is in our that also forms part of our diet, and it's something our body needs. Now, if you take excessive amount of sodium, it can lead to fluid retention. It can cause fluid to build up, your blood volume to go up, making your heart work harder. It can also affect how the elasticity the elasticity of your blood, your arteries, where the blood flows. It can make it stiffen. It can make it squeeze itself to become smaller, constrictive, so that your heart has to work harder to pump blood and make your blood pressure go up. Sodium is found in the salt we eat. It's also found in the monosodium glutamate that is used for most of the artificial spices. Sodium is also found in some of the processed foods we buy. So it's a preservative. So sometimes a lot of sodium is added to canned or packaged foods to keep it fresh. So we have to be mindful of how much we eat, and we talk about that. Then another important nutrient is potassium. It's a mineral that is also good for us. So potassium counters the effect of sodium. So it helps, it tries to prevent your blood vessels from becoming narrow. It also helps to prevent fluid accumulation. Like so, when you have diet that is contains adequate amount of potassium, it also helps you helps prevent your blood pressure from going up. So it's protective over your heart. But when you look at the kidney diet, like we learned from last week, a low potassium diet may be recommended for people with kidney disease. So if you are trying to prevent kidney disease, it's important that you know that that does not apply to you. Trying to prevent kidney disease, you rather need a diet that is high in potassium, so that we don't get confused here. And we have to try to also drink a lot of water, because if we are well hydrated, our kidneys work better. Okay, so now some of the dietary approaches for preventing non-communicable diseases, and in our case today, kidney disease, will be what we call the DASH diet. We also have the Mediterranean diet. We have plant-based diet, and with the plant-based diets, I'm not saying vegan diet or vegetarian diet. I'm just saying a diet that has more plant-based sources. Food from plant-based sources will be ideal, and also the consistent carbohydrate diet, which would be ideal for people with diabetes and trying to manage their blood sugars well. Okay, So with the DASH diets and the Mediterranean diet and all of these three I've mentioned, the emphasis is on taking foods that have a lot of fiber. So we'll talk more about that and you understand what I mean by that. Eating more vegetables, having adequate amount of fruit in your diet, taking healthy fats, so unsaturated fats, which we'll talk about to explain more. And then also with a consistent carbohydrate diet, what we're trying to say is that it's important that if you're managing your blood sugars, you have a consistent amount of carbohydrates at all your meal times. It's important for you to eat breakfast, lunch, and supper, consistent portions of whole carbohydrates at each meal time. It's important that you do not go hungry at one point and overeat your carbohydrates at another meal time. That causes an imbalance that does not make your sugars go very well and can affect your kidneys. Okay, so the main emphasis for us today is that we have to have a healthy diet plan. The idea is that we want to manage our blood pressure well, we want to manage our blood sugars well, we want to avoid excessive protein and sodium intake, and we want to take adequate amount of potassium in our diet. And with that, we have to think about the balanced diet. So this is something that I believe that we are all aware of. A lot of us have learned about the balanced diet from when we were growing up. But the most important thing about the balanced diet is that it tells us to eat food from all the food groups in the appropriate proportions, and we'll talk about that. But I want us to draw up our minds and our attention to the fact that we also have to think about food diversity when we are talking about the balanced diet. So you want to eat carbohydrates, proteins, healthy fats, including fruits and vegetables. But you should try to have diversity. That is important. And you should have food from all the food groups and in the right proportions. Okay, so a little bit about the food groups. We say that, like I mentioned, that you want to eat foods that have a lot of fiber. So fiber is something that is part of our food. Is from the carbohydrate sources that we do not digest. But what it does is that if it can form the bulk of your food, so that you are not getting too much energy from the food itself. It makes you feel full without giving you the kind of energy that can give you make you put on weight, excessive weight, or the kind of sugars that can make your blood sugars go up. When foods that are high in fiber also tend to be lower in sodium. So when you take foods that are high in fiber, it also helps you to stick to the low sodium diet, and that helps you. So you get adequate fiber that is also good for your gut, your immune system, and also helps to prevent inflammation, which is also not good if you want to prevent non-communicable diseases. Some of the fiber food sources, we have the carbohydrates, the whole carbohydrates like what you see on the screen, the cereal, so like millet, corn, sorghum, oats, and maize, and the rest. Then we also have our whole starchy tubers. So these are carbohydrates that have high fiber, which we should incorporate in our diet. This can give us energy and also help us to as part of our healthy eating plan. And some of the food sources we have, like if you cook brown rice or you cook whole millet, you make millet porridge from scratch with everything. You cook bangkun with all the dough without sieving it. You get healthy carbohydrate. You also get adequate fiber. Bread can be high in sodium. So we also have to be mindful, even though we are talking about whole carbohydrates, even if you are taking whole wheat bread, you have to be mindful that it is not very, very salty. Now, the other thing we have to look at is the our fruits and vegetables. So with fruits and vegetables, they provide vitamin, minerals. They also provide a good source of fiber, dietary fiber for us. But we have to know that they come in different colors. And since we are talking about having adequate potassium and all that, we have to be mindful of getting a variety of these. And the recommendation is that we have at least 5 servings of fruits and vegetables in a day. So presuming you eat breakfast, maybe you take your porridge with some vegetables, that would be one, or with the fruits, that can be one. within the day you could have a fruit snack, maybe a banana, or you take an orange. That can be another one. You eat your lunch and supper with contomere stew, or your supper being light soup. That can form, so at the end of the day, different servings to give you your 5 a day, at least 5 a day. And then we have to also try to have the different colors. So green leafy vegetable in particular, our contomere, for instance, tends to be very high in potassium. So when we incorporate these things in our diets, it's one, enriches our potassium intake. It's also a good source of fiber. It also has folate, which can help prevent anemia, which is good for us. Then we also have to think about the other vegetables, like the orange colored vegetables. Then we think about other vegetables, which are all good sources of fiber. We think about our fruits, thinking about different colored fruits, and that will be fine. So recommendation is that you have at least 2 to 3 fruits a day, and that is fine. If you are not diabetic and you are hypertensive and you are struggling with your blood pressure control, you could do up to 2 to 4 fruits a day, and that can help you to meet your potassium fiber requirements, and also your antioxidants and other things that can help your blood vessels to work well and make you healthy. So when we talk about the in terms of portions, with fruit, a fruit is about the size of a fist size. So it can be an orange, an apple, a banana, a half a cup, 1/3 to a cup, 2/3 to a cup of cut up fruits like watermelon, pineapple, and the rest. Okay. Then we come to the proteins. So I mentioned at the beginning that you do not want to take excessive amount of proteins. You also do not want to take it out totally. So sometimes we meet patients who say because they are afraid, maybe they were told to restrict their protein intake or take the correct portions of protein, then they themselves get very scared about the fact that they are taking protein and kidney disease, and they stop taking it altogether. We get protein, some protein from the carbohydrate food, so like your corn, your oats, and others. There's some protein there. You also get some protein from the vegetables you eat, but you need a little amount of protein, maybe from egg, from um, fish, from lean meat, such as poultry without skin, and that helps you to meet your protein requirement. You also get good protein from plant sources. So if you take protein like from sources like beans, or other legumes, lentils, if you take protein from granules or other nuts, these ones will give you the protein. It will also give you fiber, which is also good for you, like I mentioned before. And it will also not include the bad fats that can clog your arteries and give you elevated cholesterol and give you kidney disease. If you remember from last week, we learned that if your cholesterol is high to it can increase your risk for kidney disease. So if when you take more plant-based food, so plant proteins, you reduce your risk of your cholesterol going up, and that means you are making yourself more healthy. So these are some pictures of some plant-based protein. So we have beans of all kinds, nuts of all kinds, lentils, which are also very good for us. And these are examples of the lean animal-based proteins that we can also include in our diet in the correct proportions. And we'll talk about proportions. Okay. Then we'll talk about milk. So milk and milk alternatives, okay? So these can also be a good source of carbohydrates and proteins for you. They can be a source of calcium in your diet as well. And calcium is also essential in managing your blood pressure as well. Now, the milk from animal sources like cow milk or goat milk, which is mostly available in Ghana, can also contain a lot of fats that can contribute to your cholesterol going up. Now, for milk from plant sources like the milk from like almond milk, soya milk, oat milk, will not contribute to saturated fats that can make your cholesterol go up. So it is important that when we think about milk, we do not only look at animal-based sources, but we incorporate some of these plant source-based sources in our diet. Now, when you are making your own homemade milk. It's important to note that if you're making homemade almond milk or oat milk or soya milk, you will get the carbohydrates, you will get the proteins from the milk, but it will not be a good source of calcium. So you have to incorporate in your diet other sources of calcium, like that green leafy vegetables, like fish or shellfishes and other things, or talk to your dietitian or nutritionist about supplementing calcium, because if your main source of calcium is homemade milk, it will not be a rich source of calcium to meet your calcium requirement. But these can be part of our diet to make it healthy. But you have to try to ensure that you do not take foods that contain a lot of sugar. And we'll talk a little bit about sugar before we conclude. Okay. Then we talk about the fats as well. So last week we learned that if you take saturated fats, your cholesterol can go up. Now, saturated fats comes from sources such as animal fat, so like the fat under the skin of chicken, or the visible fat you see on meat. Saturated fats can also be included in your diet when you take hydrogenated fats. So when you use margarines to cook your food, or use butter to cook your food, that can also increase your saturated fat intake. And then when you take processed meat, so if you like eating things like corned beef or luncheon meat, if you like eating things like sausages, and they are not lean, it can also contribute to your saturated fat intake going up and your cholesterol going up. But fat in general isn't a bad thing if you are taking a healthy fat. Healthy fats will be the fat that you get from nuts and seeds. So fats like granite oil, or the fat naturally in the granite, like avocado oil, or by taking avocados. If you incorporate seeds like chia, pumpkin, flax seeds, and kind of things in your diet, it gives you fiber. You also get healthy fats in your diet, and that is also. And when you take healthy fats, it helps you to produce what we say the good cholesterol, the HDL cholesterol, that kind of cleans your blood of the bad cholesterol. And so fats are not bad in general. You just have to pick and choose what is healthy, and reduce the intake of the unhealthy ones. Okay, then we have to drink a lot of water. So in a day, you have to try to drink at least 6 to 8 cups of water, and a cup is about 250 milliliters in volume. So you have to drink adequate amount of water to make you well hydrated, to help your kidneys to have blood flow that is not too thick or too concentrated, and then it protects your kidneys as well. Okay, so now we can look at food portions, and we can use the Eat Well guide, or we can use our local asanka that was made by that's for Ghana. So if you look at this place, I have twisted it onto the side so that it's easy for you to see. So on the left side, the top left, we have the our whole carbohydrates. So like we have the cereals, so millet, corn, brown rice, red rice, those ones are there. We have the plantains, and then the sweet potatoes, cassava, and those ones which are whole for us. And then at the bottom, we see our plant protein. So we have beans and the others that I mentioned. Then we have our lean animal proteins also there. Then you have your vegetables, and then you have your fruit. So the idea is that in a day, the foods that you eat, about 1/4 of your plate should be the starchy carbohydrates, but choose the whole ones. And then the other quarter will be your plant proteins, and then your lean animal proteins. Then half of your plate should be your vegetables, and then your fruit. Okay, so it means that it is not very healthy when we serve ourselves a big bowl of rice, or if you take a big pack of takeaway pack of rice, and then the vegetable that comes with it is just like a quarter cup, that small cup that comes with it. That is not eating vegetable. When we say increase your vegetable intake to get fiber and the potassium and the low sodium that will benefit your kidneys, preventing kidney disease, we mean that as you look at your plate, at least half of your plate should be fruits and vegetables. And then you include your healthy fats, you try to stay well hydrated, and that way you are protecting yourself. The other thing we have to watch out for is buying foods that are packaged. So remember I said that when food is being processed, like packaged in cans or in packages, so that it doesn't spoil, they add preservatives. Some of the preservatives, it's sodium. One preservative is sodium. So when you are buying packaged foods, you have to look at the labels. You have to always buy what has less salt, less sugar, less saturated fats, and then also less sodium. So it may be written as salt or sodium, so less of that. Okay, the numbers are there, but even if you don't remember what the number is, you have to, when you are buying from the store, you see that they will display maybe all the rice on this section, all the oats on this section, all the whatever it is you're buying on that section. Go through the aisle, see what is there, pick the one that is low in salt, low in sodium, and that way you are trying to prevent excessive intake, low in saturated fats, and that helps to protect your body. Okay. So we can also talk about planning. So you may know what to eat, you may know what is healthy, but you may buy the things and you may stay in your locker until they get rotten. You don't even get time to eat it. So it's important that we try to plan our food intake so that we have we make healthy food selections. The first thing is that you have to buy the healthy food product we have talked about. So when you go to the supermarket, the first thing you go for is to look for the vegetables. So that really helps. If you go buying the meat and other packaged things first, you may end up at the end of your shopping with not having enough money to buy or enough room to buy vegetables or healthy food. So you aim first for the healthy ones. So you go for your vegetables, you go for your fruits. After that, you go for your whole carbohydrates. You buy those ones, then you think about your healthy fats and you plan it like that. Another important thing to note too is that when you are going to shop at the supermarket, you shouldn't go hungry. Research has shown that when you are buying hungry, you tend to buy unhealthy things. So the hunger drives the intake of processed things, things that are quick to eat. So you try to also buy those things. So you go, you eat well, you go to the market, you select healthy things, and that will help you, and you try to plan your diet. Okay. Some tips to help you plan to eat healthy food or make healthy meals is try to cook your food, some of the foods in bulk. So some of our foods like our stews and things can be cooked in bulk. Then you should try to incorporate the intake of fruits and vegetables. And that can be done if you prepare these before eating time. Sometimes, we buy oranges and it can be in the bucket for a long time and they'll go rotten. But I'm saying you have to eat fruits and vegetables at least 2 to 4 times in a day. So it means that you have to prep them ready to eat, and that can encourage you to eat it. So you wash your vegetables, those that can be eaten whole, you wash, you put them down. Those that need to be cut, like the pineapple or watermelons, you can cut them up into clean containers, store them in the fridge in small packs that you can have at a time, so that when you are hungry and you open your fridge, you are not going for soft drink, but when you're hungry, you open your fridge, there's pineapples already cut, and that encourages you to take what is healthy and incorporate that in your diet. You also have to pre-plan to minimize your sugar intake. I think the Ghana Dietetic Association and other stakeholders are doing, sorry, the Ghana Academy of Nutrition and Dietetics, GAND, and other stakeholders are doing very well in promoting the reduction in the consumption of sugar. So that is very important. If you do all your healthy eating things and you are drinking a lot of soft drinks and you are taking a lot of juices, it can still affect your blood sugars. So we have to try to minimize our sugar intake. For one, I would say don't buy these soft drinks and put in the fridge. If for an occasion you go somewhere and you have to drink a little, that may be an occasion that may not be in excesses. But if you are buying them and putting them down, it encourages you to take them, or you are teaching your children to also become addicted to these, and that these are not healthy habits. What we need is consistent food intake, a good a portion of your carbohydrates, breakfast, lunch, and supper, drinking a lot of water to keep us hydrated, and we're reducing our thirst and our desire for sugar sweetened things. So we should try to cut these down. And we can also buy foods in season, seasonal foods, and then store them so that it reduces our cost, it helps with our budget, and it also encourages us to heal to eat healthy meals. Okay. Some barriers that some clients or patients will say that is not making them eat well would be that they don't have time, that unhealthy food is more convenient, it's more available, and that sometimes some people will say when they are stressed up, they feel like eating some particular unhealthy things. Okay, we can reduce these problems by prepping the food. So like I said, dedicate a time in the week where you buy your things, you prepare them for the week or for 2 weeks in advance, and it will encourage you to eat well. You can also try to snack on healthy things. So instead of snacking on things that contain margarine and white flour that has very little fiber, snack on fruit, snack on nuts, snack on yogurt, like whole yogurt unsweetened. You can cut your fruits and put inside, and then also try to make these readily available at home so that when you need them, you have what is healthy. Even if you are doing emotional eating, if you have these healthy things there and you feel emotional and you feel like eating and you're eating a banana, that will be better than when you feel like eating and you take a whole pack of biscuits, which is low fiber, a lot of white flour, and also may contain a lot of sugar and a lot of sodium. So we have to always be trying to pick what is healthy. Then we also have to try to be mindful of what we eat. So we try to listen to when you are hungry and when you are full. Try to eat, focus on your food. Try to take your time to eat. Try to avoid eating in a rush or eating when watching TV. These things can take your minds off your hunger and fullness cues, make you overeat, and then that way it can make you be putting on weight without you understanding how the weight gain is coming up. And also try to manage your stress. So stress can increase your inflammation levels, can increase your risk of disease as well. Stress can make you emotional and make you engage in emotional eating that can make you put on too much weight. So try to distress. Use any form of relaxation technique that works for you, like prayer, like meditation, like exercise, and that can also help to prevent your emotional eating. And then seek support. So sometimes we have to work in groups. If you know you are trying to lose weight, you have a friend who is also trying to lose weight, you work together, you encourage yourself, you share what you are eating. You go shopping together to buy the healthy things, and little you share recipe ideas, little things like that. Seeking support, contacting your nutritionist or dietitian for guidance on what to eat and what not to eat, that is tailored specifically for you, can help you also to eat well. And then some of the general things that we can do. So we talked about maintaining a healthy weight. So if you are already overweight or obese and you now want to be healthy, you want to do what is right, what we say works well for people is for you to aim for gradual sustainable weight loss. So gradual sustainable weight loss means don't try to do a crash diet to lose weight. Don't try to lose the weight that you use some 5 6 years to gain or a year to gain, to lose it in a month. Gradual weight loss means that you try to eat regularly. You try to be mindful of what you are eating. You pack your plate like what we saw. At least half of your plate is your vegetable and fruit, your whole carbohydrate. You minimize the amount of fat you put in your food, because the energy from your food that makes you put on weight comes from your carbohydrates, excessive fat in the diet, and excessive protein in your food. So when you prepare food, try not to make oil run around your stews. It means you're adding too much fat to your diet. So minimize your fat intake or oil use, and use some cooking techniques like grilling, baking, steaming that does not involve the need for adding added oil or added fat, because naturally the corn has fat, the potato has some natural fat, the fish has fat. So you really do not need to add a lot of oil or fat to your cooking. It's just preference from what we have come to become adapted to. But you can add natural fats like a little bit of nut here, a little bit of avocado without adding excess fat. And then also try to eat regularly. So when we say, sometimes when people say they want to lose weight, what they do is that they may say, I want to lose weight, so I won't eat breakfast. I'll wait and eat my lunch at 3 o'clock, then I eat supper. And then what happens is that you may become very hungry, and then you may overeat your next meal, and then you have spoiled everything, and then you put on. The other thing too is that it means you may be doing inconsistent eat. So at one meal time, your carbohydrate intake was very low. Another meal time, it was to the roof, and that can disturb your insulin and other mechanisms that goes on in your body and affect your blood sugar. So it's better to eat small meals, small carbs with your vegetable, your protein, and everything, but regularly, and have at least 4 to 6 hour intervals between your meals. You also have to try to add a lot of vegetable, which can make you feel full for longer and reduce delay your desire to overeat or eat or snack between meals. And then try to drink a lot of water. So drinking water is something that we have to make part of our lives. Not everybody feels tasty. Some people will tell you they don't really feel tasty, but even if you're not feeling tasty, aim, our weather is hot here, so aim to drink your 6 to 8 glasses of water. Have a friend to remind you haven't drank water, because sometimes as we age, some people lose the ability to sense that they are thirsty. So you can get people to remind you. Put the water in your bottle on your table to remind you have to drink water, you have to drink water, and that can also help. Minimize sugar intake, minimize alcohol intake. In particular, for those who take alcohol and with added herbs, that you don't know what it is. I remember last week we learned that some herbal products can be toxic to your kidneys and can lead to kidney disease. So if you are buying any concoction or any herbal product or any alcoholic thing that is bitters, that contains herbs that you do not know what it is, you should know that you are increasing your risk, because even if something happens, you don't even know what exactly you are taking. So we should be mindful, especially the bitters and things that we drink, which may not be very healthy for us. And we should try to be active, keep a healthy lifestyle, quit smoking if you are smoking, limit our alcohol intake, exercise, improve our social life. So if you are too much to yourself, that can also stress you up and then can affect your BPs and make you unwell. Okay, so with exercise, we are saying that you should aim for at least 150 to 300 minutes of exercise per week, like moderate intensity exercise per week, or 75 to 150 minutes of vigorous exercise. So moderate intensity exercise could be like taking a walk, things like that. And then also the vigorous one could be cycling, could be swimming. So we have to include some of these exercises, and we have to try to engage in a combination of these, some vigorous exercises, some moderate, and make sure that challenges your body and keeps your heart working better. And research has shown that those who exercise well, exercise itself alone also reduces your risk of kidney disease. So it's something that we have to incorporate in our lives, being active, and then also adding planned physical activity to our lifestyle. And then also we try to sit less, walk more. At your office, try to walk a little bit more. Pick your own paper from photocopier machine, use the stairs more than the elevator, use the washroom on another floor. At during your lunch break, try to walk a little bit around your block before you settle to eat. These little things can increase your exercise efforts and make you more healthy. Okay. Okay, so my references were from the Ghana healthy eating guidelines, and this is where I'll end. So I think I'll end here, and when you if you have questions, it can help me to add on what I haven't added or any clarifications to make it easy for all of us. Thank you.
All right. Thank you, RD and Estina. That was a great presentation. Great. We're now open for questions, comments in the discussion section. Kindly drop your messages in the chat box. You could also raise your hand and you will be called to ask your question. We have some comments and questions in the drop box. We'll start there whilst we check to see whose hand is up. I'll take a few and then we go back to RD and Estina for her comments to the questions that have been put in the chat box. All right. So someone is asking, what percentage of the food should be sodium for it to be low sodium food product? I think percentages will be better than grams because the size can change. And so I'll take about 3 questions and then you respond to them. The next question is, what might be causing one's flatulence to be smelly extremely bad after incorporating eggs in your meal and cabbage, but you just a minute, but you are to take eggs anyway. Note that the individual has kidney issues. Then the third one, thanks for educating us. If you already have a problem with your kidneys, what foods can you take to boost your kidney health? Or if possible, to reverse the situation? RD and Estina, can you please take these ones? Felix, I'll call you. Kindly keep your hand up in the next round. Thank you.
Yes, please. Okay, so I think I'll talk first about the sodium. So the person asks what percentage of your food should be sodium. So maybe it will be challenging to say what percentage of your food itself, but I can tell you what percentage of sodium you should what amount of sodium you should be adding to your food. So in a day, if you're not diabetic, the recommendation is that you can have about 2,300 milligrams of sodium in your diet. That will add up salt. That is all. That includes the salt that is already in the meat. That includes the salt that is already around the granules that you will be eating. You understand? Now, if you have hypertension, the recommendation is that you do 1,300. So that would be like a little a little more than about a half or a little more than a third of a teaspoon of salt. Okay. Now when you're buying packaged products, when it has less than 0.3 gram of salt written on the container, that is also low sodium. So those are some of the things we do. But since you know you're getting salt, a little bit of salt from your bread, your nuts and things, you have to try to minimize how much you add to your food. So you could decide to cook your rice without salt, your yam without salt, a pinch of salt in your stew. We add other things that are very salty, Kobe, momone, kako, these salted fish that we add. Even if you said that your stew didn't become salty, but when you were eating your Kobe momone, it was salty in your stew. It means you've added more salt to your food intake. So we have to be mindful of all these things. Maybe minimize how much you add or boil it a little to reduce some of the salt inside. Minimize how much of the monosodium spice you add. That's also where you get your salt from. Use natural spices like onions and bay leaves and peppers and all those things, garlic, and that's where you'll be cutting down on your salt. I think that's how I can make it more practical for the salt question. The question about the flatulence about the egg, I didn't really get that very well. I don't know how we, if you have intolerance for eggs, you can have your protein from other sources as well, and that can be very helpful for you. Please, have I answered all the questions?
So there's this one on if you already have a problem with your kidneys, what foods can you
Yes,
take to boost your
yes.
kidney health
So if you
or
already
to
have
reverse the
problems with
situation?
your kidneys, it depends on the stage of your kidney disease. The the diet for people with kidney disease varies according to all the stages. If you are early stage kidney disease, let's say stage 1 or stage 2, what I have talked about now will still apply to you. You are trying to prevent, if it's your hypertension that you are not managing well, you are trying to make it better. If it's diabetes you have, you want to take foods, whole carbohydrates, be consistent with your portion of carbohydrates, eating more vegetables, so it still applies to you. But if you have a higher stage of kidney disease, your eGFR is lower, you will need to see a dietitian about that. You need to see an expert, clinical nutritionist who has expertise in renal nutrition, to help you with the your specific portions, tailor the diet to you, because it will depend on your weight, it will depend on your labs, it will depend on other conditions you have. So I'll suggest that if you are above stage 2, 1, 2, don't try to do the diet on your own. Dietitians are all over the country. Hospitals with clinical nutritionists are all over. Go to the hospital and talk to somebody, and then they will guide you for what is specific to your own condition. Thank you.
All right, great. Thank you for the response. We'll pick the next round. Before then, someone says a very educational session. Can you share the recording with us? Gand, Maxwell, can you respond to that in the chat box, whether the recording will be shared with them? Great. So the next batch, one says, please, eating banana about 5 to 8 fingers daily throughout the week, does it have any negative impact on your kidneys? Then the next question is, someone wants to know what is the pathophysiological link between herbal medicine intake and kidney disease? And there's a follow-up to the, herbal medicine issue. Someone said that it's a great question. A relative of mine kept taking local herbal medicines to treat malaria and ended up developing liver and kidney problems. So can we take this round?
Okay. So I think that about the herbal medication, right?
Yes.
Yeah. Okay, I'll start with the herbal medication. Okay. So the link between, so it's not just herbal medication. I think within the week, one of our dietitian had a presentation on a TV station to talk about this. So it's not just herbal medication. No, in medication, there can be toxins. Even in orthodox medication, sometimes there are things inside that can affect your liver and your kidneys. So there's a prescription that a doctor will write for you and tell you that take this quantity, or number of tablets, or this amount, quantity of the medication. That's those quantities are given you because they have factored in the toxins that are inside, and then the active ingredient that can heal your condition, so that you do not take too much of the medication for the toxins inside to cause you harm. Now, if you are taking herbal medication from a prescribed source and they know what it is, they will also know the toxin that is in the herbal medication you are taking that is toxic to your kidneys, and they can guide you how much of the herbal medication you should take. That will not be a problem. Some of the herbs too, naturally, they contain things that will damage something called nephrons that are inside your kidneys. The thing that does the work of the kidney itself, the thing that strains the kidney of the waste product, and it goes to damage it itself. So if you are buying the herbal medicine by yourself from the street, from a herbalist who doesn't know about prescription and dosages and anything, You may take too much of the herbal medication. That will mean you are taking too much of the toxin that will go and cause harm to your kidneys. If you are taking it from somebody who is not a trained herbalist to prescriber, you may be getting herbal medication that is known to actually damage kidneys and then the liver. The specific pathophysiology for all the different types of herbs may be different. But since you are not a herbalist, I'm not a herbalist, you have to speak to the people who know what to do and they can guide you. So you don't just go drinking, they say drink a gallon, you're hypertensive. They go and they give you a drink a gallon of something. You don't even know what it is. They don't tell you how much of what it is. You just keep drinking and keep drinking, you may be damaging your kidney. So that's all I would say about, that's what I can say about the herbal medication. Be mindful where you get it from. You be mindful who is preparing it for you, whether or not they know what they are doing, and then so that you do not make your condition worse. But sometimes we say that food is medicine. Even healthy eating, eating the vegetables, eating the whole carbohydrate, eating those things can cure your disease. You may, I mean, not like can make you healthy enough to prevent disease, so that you do not need to take any medication or herbal medication to cure you. So we should just try to eat well. Okay.
All right, great. There's this bit on the banana, 5 to 8 fingers of
Yes.
banana throughout the week.
So fruits are good for us, but everything we eat has to be in moderation. So like plantains are carbohydrates. They are fruits, but they are still carbohydrates. So, like I said, that your carbohydrate intake should be consistent. You shouldn't eat too much at a time, too little at a time. You should have to take consistent amounts regularly. For fruit, what we say is that the major reason why we take the fruit will be for fiber, for antioxidants, for minerals. Okay. When you take too much fruit at a time, you also get too much carbohydrate because fruits contain carbohydrates. It won't give you too much mineral at a time, because if you take too much bananas, your potassium levels will go very high. If you are not a kidney patient, your kidneys work very well. Your kidney will try to correct the problem. It will flush out all the excess potassium because it will realize that there's too much potassium in your blood. It will clear all the potassium for you. So you won't get too much potassium, but what you get is too much carbohydrate, which can make you put on weight. So the best way to take your fruit is to take your fruit one fruit at a time, spread it throughout the day. So if you want to take bananas, you can do banana mid-morning, banana later on in the day. Try another fruit. Remember, I said it's better to have diversity. So when you eat only bananas, you miss out the nutrient that is in watermelon because of the red color. It has another antioxidants more. So try to have variety and have smaller portions but spread out throughout the day, and that will make you more healthy.
All right, great. We move to our next batch. Felix, you had your hand up. We have lost you. Kindly raise your hand if you have some questions, or drop your questions in the chat box. I'd like to acknowledge Prof. Kolai and Madam Ruby Asa, Chief Dietitian, Ghana Health Service. They are on the call. Towards the end, we'd ask for some comments from you. So kindly stay with us. Thank you. Back to the questions. Someone is asking what your take is on the popular online diets such as the keto diet. And there's a question also that says, please, can chewing moringa leaves reduce the risk of kidney disease? And then a third one, a patient who has several NCDs such as diabetes, hypertension, stroke, and kidney failure, how can this be tackled? Over to you,
Okay.
dietitian.
So yeah. So I think the first one is the keto diet. Okay.
Yeah.
So the keto diet is a diet, a type of diet that focuses on more fat intake. So the idea is for you to take a lot of fat so that your body shifts from relying on glucose for energy, and rather shift to ketones for energy. And that way you tend to burn body fats in the process as well, and then you lose weight. Okay. If the keto diet is done well and well guided, it can achieve the result of weight loss, because I presume that is the main reason why somebody would want to do that. The main purpose for keto diet, I should say, is for managing epileptic seizures. So the use of keto diet for weight loss is a bad thing, like that. People notice that the epileptic people who were on the diet were losing weight. Okay, so if people want to lose weight, they can also use the keto diet. Okay, so the thing is, if it's done well, it can help you to achieve your weight loss. But when you achieve your weight loss, you have to be weaned off the keto, and then you have to return to healthy eating plan. It is not healthy to do keto for life. One, because a diet that is very high in fat may make you also take high amounts of saturated fats, which could make your cholesterol go up. It may be difficult to stick to only healthy fats. And even some of the healthy fats, we say they are healthy fats, they have some amount of saturation. So if you take too much of even some of these healthy fats, it can make your saturated fat intake also go up. So if you do excessive fat intake for prolonged periods, your cholesterol level could go up. The other thing too is that it creates an imbalance in your energy intake, so that you may have adequate amounts of the fat soluble vitamins because you are eating a lot of fat, but you may be deficient of the water soluble vitamins. So it can create an imbalance. So if you're on the diet, it means that you have to be supplemented with water soluble vitamins as well to help you to meet your requirement. You understand? So what I would say is that if it is weight loss you want to do, you should see uh, um, a professional, somebody who is trained, a nutritionist or a dietitian can help you with weight management. Now, they will know, even if it's keto diet you want to know, they will know how to do the keto diet for you. That will not cause an imbalance in your system to make you sick later on in life. And also they will make sure that your weight loss is not drastic, so that it can cause an imbalance again that can bring diabetes and other things along the way as well. So seek professional help. The online resources can guide you with recipes and things that you need to give you variety if that's what you want, but you should seek professional help so that you are sure you are taking the proportions that are appropriate for your own health, and then they weigh you off it when you have achieved your target weight, so that you can rely on healthy eating practice like we have discussed here, which is more sustainable. Thank you.
All right, great. The
And then the
question
other
on
one
moringa leaves. Chewing moringa leaves, can it reduce kidney disease?
yes. So moringa, okay. Can it reduce kidney disease?
Yes.
Okay. So the thing is that moringa is a moringa leaves contain a lot of minerals and vitamins. It's a good thing. Okay. um in terms of the minerals that I said are important to kidney health, I mentioned potassium is one of them. If you take an adequate amount of potassium, it can relax your blood vessels, it can prevent counter the effect of fluid retention, and in that way makes your blood pressure better. If you take moringa leaves, it will give you adequate amount of the potassium. So it's a good supplement, like natural supplement that you can add to your diet. It can help to improve your blood pressure, which indirectly will improve your kidney disease. But I wouldn't say it directly cures your kidney disease. So there should be a balance. The small proportions of moringa at the early stages of kidney disease, like I said, stage one, stage two, healthy eating is okay. So if you're adding a little bit of moringa, that is fine. But if you have kidney disease, the doctor has told you to reduce your potassium intake. If you take moringa blends or too much moringa something, it will be too much potassium. It can take you to high potassium levels, hyperkalemia, and that can kill. So you need to talk to, if you really have kidney disease, don't do just go do moringa. Talk to a dietitian about it, talk to a nutritionist about it, get them to guide you how much of the moringa you can take, and that will be safe for you. And then and I think that can help you.
All right. So a patient who has several NCDs such as diabetes,
Mhm.
hypertension, stroke, and kidney failure, how can this be tackled?
So I would say it is important that you see a dietitian. I know when people are unwell, they are really happy, eager to see a doctor. But you get the nutrition education, a bit of nutrition education from the doctor. But if you see a dietitian or nutritionist, you'll be surprised the details in which they can go with you specifically for your condition and make you better. So I would say that you should try, go to the hospital, book an appointment, or after our presentation today, talk to the organizers. They can guide you, direct you to a dietitian or nutritionist who can sit with you and guide you, look at your labs, see how they can help you specifically to make you okay. Because if you have a lot of comorbidities, online education may not be enough to help you do the right thing. But I should still say that stick to whole carbohydrates, stick to eating adequate portions of vegetable, minimize your bad fat intake, take lean proteins, include beans and nuts in your diet, but see a professional for help.
Great. Thank you, RD and Estina. Someone asked the question as a follow-up to the banana issue you talked about. And so the person is asking whether kidney patients should avoid banana altogether.
Okay, so for people with kidney disease, unrestricted potassium intake, a full banana may be for some of them too much banana at a time. So when people have on protein, potassium restrictions, the recommendation is that they take fruits that have lower potassium. So you may want to restrict yourself to fruits like tangerine or apple or a half cup of mango or pawpaw or watermelons, but not bananas until you talk to somebody who will check your labs and see whether they are okay for you.
All right. Great. There's a question from Ernest. He's asking whether cooked vegetables are better than raw vegetables when eating.
Mm. So I think it depends on how you are eating, but I think some research show that I think we absorb a little bit heated up vegetables better than when they are fresh. But you still get the benefits of the fiber, you still get the benefits of the low sodium content, whether or not it is cooked or it is fresh. If you are taking the vegetables in terms of specific vitamins, some of the vitamins becomes denatured when they are cooked. So, for instance, if you are looking for vitamin C and you are eating fresh vegetables, that will be better than when it is cooked. But the general rule is that vegetables should not be overcooked. So you can toss it a little. You can also eat it as a salad, but have a good blend of these two, so that you get both benefits of the fiber and all the nutrients and all the mineral benefits as well.
All right, thank you. So if you joined the call, after we gave an introduction, we're still celebrating the Ghana Academy of Nutrition and Dietetics National Nutrition Month, and our theme is the role of diet in preventing chronic kidney disease. We're making every bite count. Today, RD and Estina spoke to us on this theme, and we are discussing and asking questions and bringing in our comments. And so the question about other problems associated with diet, how about undernutrition and the possible remedies? Today we are talking about the role of diet in prevention of chronic kidney diseases. There may be a time we would go into other areas such as the undernourishment and the possible remedies. So let's move on with our batch of questions. Someone is asking, at what stage should a patient with kidney issues be referred to a dietitian or nutritionist? And there's a second one from the same person that says, how can their medications have effect on their diet plan?
Okay. So I think if you have been told you have any kind of kidney disease, don't wait. Talk to the doctor immediately, even if it's stage one. The thing is that when you what diet does is it can delay progression of the kidney disease. So if you see a dietitian early or a nutritionist early, you may delay your progression better than if you wait until you are a step to doing dialysis before seeing a dietitian. It really helps for those who seek the resources of a dietitian early. They will tell you the kind of benefits it gives them, and it will prevent you from later on regrets. Okay, so the medication is good. The dietitians are trained, they know how to deal with what medication you have, medication, food and medication interactions. They are schooled in all those things. So if you see them, they can guide you, they can help you. If you are stage one, they can delay the progression a lot for you. And that is better than if you come to them when you're already stage three. I mean, if you come later, there's the dietitian can help you manage your condition, make you comfortable, but it wouldn't be the best. But if you come early, I think that is the best. So immediately you are told you have any form of kidney something, tell the doctor, I want to see a dietitian or a nutritionist. That is when you need help. And I think that is, and even if you are not sick, I mean, it is okay. People will go and say they want to do medical checkup and they'll go and do their labs and be happy and go home. But you can just go and say, I want to see a dietitian, not because you are sick. We get a few people doing that, coming to just be sure what they are eating is okay. It will help to save your life. It will prevent a lot of things, and I think that will also work for you.
All right, then a bit on the medication. How can their medications have an effect on their diet plan?
So the medications, I think I said a bit of that. They take different medications, so you can't help yourself. Seek a professional help. Let the professionals know the medications you are on, and then the kind of diet you should be on. That will not interfere in the medications you have. So I think that has to be specific. We have to know the medications and know what you are eating and which one will affect what, and how we can go around it and still remain on a healthy diet plan.
All right, great. Felix, I see your hand up. Kindly unmute and go ahead with your question. Hello, Felix. Hello, Felix. Kindly unmute yourself and go ahead with your question. All right, as we wait for Felix to unmute
Yeah,
himself,
hello.
great. Yes, Felix, kindly go on.
Yeah, so thank you so much for the presentation, and so much of what you have done has been very clear. There is this concern. So nowadays we advise people to take in more fruits and vegetables, but we also understand that concerns have been raised about the production of these fruits and vegetables of late, as most of them have been from the production sector have been chemicalized, and even evidence has shown that some of these chemicals which are applied inappropriately are also having health effects on the population. So in this regard, many people are now having concerns as to the fact that if the very fruits and vegetables that we are advised to eat are also giving us a health issue, so what do we turn to now? So in this regard, what as an association, the Dietetics and Nutrition Association, what is the way forward in line with what is actually happening around the fruit and vegetables consumption, since that is a sure way to also manage some of the NCDs that we're talking about?
Okay. So in terms of what is happening, I know some of my senior colleagues are on the thing, and so they can talk more about what is happening. But for you, the consumer, I think as a dietitian, the kind of advice I can give you, the consumer, is first of all, try to purchase your fruit from a good source. Okay, know the farm, know the place you are getting your food from. And we have people who are actually growing. You can go, you can see, you can be sure, buy from them. Okay, the other thing you can do too is that the fact that the chemicals are out there doesn't mean that all of it is contaminated. There are ways you can minimize the quantity of chemicals that you get. So the first thing is that you try to wash your fruits and vegetables under running water. So don't put them in a bowl and we'll pour water on it and wash them. No, wash the chemicals away. So you wash them under running water for several minutes. That way, even if the chemicals are there, you wash it off. They actually wash off. So research has been done to show that when you wash off, the contamination goes down. So you wash under running water to bring it down. So that is one thing. You could also look at taking vegetables and fruits that can be peeled. So when you peel it, it will minimize it a little, the contamination. So you wash it very well under running water, you peel them, and that can also help. And then in terms of policy and what is being done, I think my senior colleagues can answer better, but I would say go to a place where you know what they are producing, buy it yourself, and then you know it's from a good source. And then some of these places are there that are not expensive, and you can also grow your own, a little bit of contomere in your backyard, a little bit of tomatoes in your backyard. These are ways in which we can ensure that we are getting something that is wholesome. And so that's what I would say, but my colleagues will add up to what I've said.
All right. Thank you. Thank you, RD and Estina. So someone is asking, how is their fluid requirements estimated? So kidney patients, how do we estimate their fluid requirements?
Okay. So in a day, the major, the means in which we lose water. So we know we take water through our food or as drinking water or the drinks we take. We get water from there. The fluid goes into our body to help our body system work. Then it comes out. So it comes in and we take it and they come out. The fluid comes out in the form of urine. It comes out in the form of sweating. Okay, so this is how they estimate the requirement. Um, Usually, your urine output is measured. So, presuming the person was able to pee about 1,000 milliliter of urine in a day, the doctors know the person also lost some fluid from sweating. That one we don't see, we are not peeing it, but as we are sitting in this our hot weather, we are sweating, and then we are also perspiring. So we are losing steam and vapor from our body, and that is also water. So that may be about 500 to 750 ml, depending on the where you live and then the kind of heat that is there. So your doctor or your dietitian will add that standard amount to the volume of your pee for in 24 hours, and then guide you and tell you that, so you're able to pee this amount plus this one, so you can drink this amount of water in a day. So that is how it is worked out. So if you have a kidney disease and you have been told to check your fluid, but nobody has told you specifically how much you should drink, measure your pee in 24 hours so that when you go to see your doctor or dietitian, you can report that I was able to pee this volume in a day, and then they will guide you how much you should drink.
All right, great. So in the chat box, for those of you asking for the recording, there are two links. A link to today's webinar on what we are discussing, and there's a link for last week's presentation also in the chat box. So you can kindly check and save those links to take you to the webinars. Great. Someone is asking that a patient was asked to eat not to eat ayoyo. What could be the reason?
I also don't know the reason. I don't know who asked the patient not to eat ayoyo. Ayoyo is a green leafy vegetable. So since I don't know the patient, I don't know who said what. I can't really tell. But if you feel you are concerned about not eating a ayoyo, you will see a dietitian and raise the concerns that you have, presuming that you didn't get that education from a dietitian and nutritionist, so that they can also like a second opinion to know whether you can eat ayoyo. But I don't see why, unless I know why I can't tell.
Okay, so the one who asked the question on ayoyo, can you please give us some more details? Probably it would help RD and Estina give us some more comments on it. I see Gifty's hand up. Gifty Kosa, kindly unmute yourself and go ahead with your question. Gifty Kosa. Kindly unmute yourself and go ahead with your question. All right. As we wait for Gifty to unmute, someone is asking that could you please take the fluid requirement estimates again?
Okay, so I
Kindly
said
go.
they measure your volume of urine in 24 hours. Then they add a specific volume. Some of the textbooks will say 500, some will say 750, some depending on the temperature, like the weather from where the person is coming from, and that volume is added to the volume of fluid you pee, the urine you pee in 24 hours, and then they can estimate, they can tell you, so drink this amount, so like to create kind of a balance. But you have to talk to your doctor about it. What the doctor will need is your volume of pee in 24 hours, so you can measure that, and then when you go for your consultation, you can tell the doctor, I pee this volume, and so how much should I drink, and the doctor will tell you.
All right, great. There's a question around still the fluid intake. Someone says, I understand that an average person should take, on average, people should take about 2.5 to 3 liters of water a day. Is this good enough for kidney patients?
Okay, so on average, people should take about 2.7 to 3 liters a day. Okay, I mean, maybe 2.5 will be for younger people, but for a day. But for kidney patients, in the early stages, your doctor may say drink a lot of water. But at the later stages, if you are not urinating a lot, your doctor will restrict you. So if you have a kidney problem, when you see the doctor, you should ask about, doctor, what about my fluid? How much water should I drink in a day? How much fluid should I take in a day? And that can guide you. But because I don't know the stage of kidney disease, I can't tell. It depends on the instructions you get from your doctor, whether or not you are at the stage where you should drink more, or you're at the stage where you should drink less. You should seek your doctor's advice on that one.
Please, I'm
Okay.
back.
All right, Gifty, great.
Yes, please.
Kindly go ahead.
So mine is a suggestion, an addition to the question the lady asked about the yo-yo.
All right.
Okay.
So with the yo-yo, kidney patients are required not to take high potassium diet, but all of that will be based on the lab that's the uh, renal function test that the patient does. So when we got to know that the patient's potassium levels are very high, all these green living vegetables are high in potassium. So either we will teach you how to leach those potassium, or you stay away from it. So it's the reason why they say that you cannot take ayoyo, but then it doesn't mean you can't not take at all. You will either be taught to leach it out or reduce its intake when your parameters are high of potassium are high. So it's the reason why. Thank you.
So
All
I think
right.
we
Thank
should
you,
try
Gifty.
to avoid telling people not to take at all. We have to
Exactly.
factor you have to factor in their socio-economic situation. And yo-yo is very affordable leave for everybody to eat. You understand? You have to take into account their natural preferences. You don't go telling people don't eat this if that is the only source of potassium. So we have to really we what we do is we investigate if the person has even high potassium, you take a thorough diet history, you investigate which of the foods they are eating that could be contributing to their potassium level, find alternative or teach them how to reduce portions to stay within. Okay, if we go on don't, we tend to overly cause people to overly restrict, and then they are they will run into malnutrition. So if somebody asks something about malnutrition, maybe malnutrition related to kidney disease because of over restrictions. So if it's because of kidney disease, you shouldn't take a yo-yo. No, that you can take a yo-yo, but it should be the overall intake. So seek another dietitian, somebody seek a dietitian's consult on the ayoyo issue, and then let them sit with you again, consider all the other things you eat, which one you prefer over what. And I think that will improve your lifestyle. That will make you happier, because food is important. It makes us happy. So you should enjoy what you eat. You understand? So to the
All
ayoyo
right.
person, I think I should seek second opinion about the ayoyo again.
Okay. Thank you, RD. Prof. Bolayi is on the call. His hand is also up, so I'll just ask him to unmute and ask his question or give his comments and add any other comments he wants to add to today's presentation. Prof. Ayi is with the University for Development Studies and the Northern Branch of GAND. Prof. Ayi, you're welcome, and over to you.
Okay, thank you very much, Madam Moderator. First of all, I want to commend RD Tina for the wonderful presentation. I mean, especially in fact, the response that she's given so far are wonderful. I really enjoyed it. I enjoyed the presentation, and I'm also enjoying rebuttals to questions that have been asked. This, first of all, to add something to a statement she made earlier concerning what is being done on the policy front. I think we are aware of the sugar sweetened beverage thing that we did, fiscal policy, which has gone through. There are other things that are beginning to come to the fore. In other words, we're looking at things concerning policies that will help in labeling, in the way we identify certain foods. Certain foods that are high in some particular. In other words, the nutrient profiling of products that will be on the market. We're trying to look at all these and help. Hopefully, we bring up policies that will help to guide consumers, and also policies that will restrict manufacturers from some of these things that they're doing wantonly, so that it will help. It will go along. We also have policies that are going to guard against the environment. What we call health environment, nutrient or food environment, or diet environment. Let me put it that way, so that we will have a healthy diet more predominant in our environment, so that people will know exactly what to eat and so on. There are a lot of things that we have to do. I think in my own personal view, one of the things that we also have to consider is the nutrition agric nexus. We need to bring the agriculturists on board in our nutrition quest for good nutrition, because if we talk, and they are doing the production, they are pushing the production, and they are producing and bringing us unsafe foods and unsafe products, then what are we doing? We are not doing much, because that is where the problem will be coming from. Because talk about fruits and vegetables being sprayed with chemicals, the food safety aspect, they are supposed to be controlling those areas. If we don't bring them on board for them to understand what we are doing, it will not go anywhere. But I think I must commend GAND very well. I commend all the organizers of this. In fact, initially I thought it was a CPD, and I overheard one of those those who did the introduction saying it was meant for dietitians and the general public. So I asked whether it was for dietitians, but I was given the clarification that it's for everyone, and nutritionists are part of it. That's brilliant. I think we need to forge ahead together, nutritionists and dietitians. There should be no divisions. I don't want to see division, because look, I'm a nutritionist, and all that we have been talking about, I have done them. I've gone through them. I'm not practicing though. But so it doesn't mean that if I get the opportunity, I cannot do it, or I cannot help myself in that direction. So let's work together. But I have one concern. I think that the things we are talking about when it comes to chronic kidney disease, it is I would say a metamorphosis of all other non-communicable diseases, but it's rather an addition. Okay, it's a kind of a condition that is culminated from other non-communicable diseases. We know of diabetes, we know about cardiovascular disease, we know about so many other conditions, non-communicable disease, will culminate in kidney failure or kidney disease. We are seeing that. It tells you that non-communicable diseases are so related. And if we are looking at the moment, we are just looking at kidney disease, chronic kidney disease, but we are mindful of the fact that if we don't look at diabetes very well, we don't look at cardiovascular disease very well, we don't look at respiratory infections and so on very well, it will end up in chronic kidney disease. So we are in a certain state where we don't, it's just like me teaching anatomy and telling the students that we will do physiology later. Meanwhile, the two are supposed to be taught together, because you can't divulge physiology from anatomy. But we do that for the ease of understanding. And I think that is why we are doing this. It's great education that we need to do, continually do. But we have a huge task on our hands as nutritionists and dietitians. We have a huge task, but the field there is so vast and the ignorance is so great. I mean, we need to do more than what we are doing. This is clearly amongst ourselves. And I commend Hardy Prince for going on TV and all the people who are going out there. This is Nutrition Week. We must go out there and shout on the radio stations and tell them what the important things that they need to know. Because we have a huge task on our hand as GAND and any other person who is nutrition conscious. We need to do more so that we can bring all these non-communicable diseases, we nip them in the bud, because it's the problem. The main problem is all that we see. And then finally, as a public health nutritionist, I think we are looking at the other end of the stick too much. We're looking at the lifestyle disease, and so we're looking at adults and adolescents or even older people who are getting these conditions. But where did they start from? Where did these conditions start from? I asked that question the last time, and I'm sure Dr. Mensah, he answered it very well. He was, in his whole presentation, he talked about the fact that we need to go back and look at where the maternal stages, in the mother's womb, in the first 1,000 days. If we don't concentrate on that, we will continue churning out people with kidney disease, irrespective of what we are doing. So let's look at this wide spectrum of interventions that we need to do so that we can curb this menace, because it's a big issue. I tell my students, if I get kidney problem, I'll go and sit at the mortuary and wait. It's a joke, but I mean, I just try to let them see the enormity of the situation if you have a kidney disease. Once again, let me say thank you very much, Auntie Tina, for the wonderful presentation. Thank you.
Great. Thank you, Prof. Ai, for the wonderful contributions and the comments you have shared with us. Madam Ruby Atta, Chief Dietitian, Ghana Health Service, kindly share your thoughts or comments with us if you have any. You can unmute and start anytime when you are ready. All right, I see Ziem's hand up. Ziem, kindly unmute yourself and
yeah, can you hear me?
Yeah, Ziem, kindly go
on. I'm speaking from Woodbridge in Virginia, US. We're talking about nutrition and our health. My question is, what about those with little to eat, and what can they do to increase their nutrition for better health?
All right, over to you.
Okay, so please, in terms of little to eat, you mean, I want to understand, is it that they are unable to eat well, or they are unable to afford to eat well? Which one do you want?
That is correct. Those with little money have virtually very little to eat. So what can they do? The little that
let's go. All of us.
Yes.
Let's go.
So that is, I think this is very important, so that I talk more about
your hand.
Diversity aspect, you see. So even when you don't have, there's affordable food that is nutritious. Okay, if you are focusing on, let's say, if you're talking about your proteins and you are looking at meat and chicken, that is expensive. But if you're looking at taking beans, taking nuts, those are affordable. In terms of, that's why when the Ayoyo question came up, I said if it's because of kidney disease, we shouldn't restrict the ayoyo. So if somebody cannot afford cabbages and those ones, but they can afford ayoyo, alefi, ademe, these are also vegetables that are nutritious, that are available, that grow wild in our backyards, you see. So the important thing is that it is not about what specific food ingredients or specific brands, no, but it's about the nutrients. So we are talking about take whole carbohydrates. So millet is cheap. Instead of, people will only use millet for hausa cocoa, but you can actually cook the millet like rice and eat it with stew, and it will be delicious. Okay, you can use the millet for banku, you can do millet banku, so you can have our cereal. So we shouldn't just look at rice or corn. All these local wild cereals that are healthy, they are fine. Our root and tubers, cassava and pesi, you can do your nice cassava and pesi with your cassava leaf stew. It is still nutritious, very affordable. We should incorporate the intake of beans. So instead of, when we say protein, our first, that's why I said plant-based diets is more beneficial. It's also beneficial for promoting health and preventing kidney disease. So you can do so it doesn't have to be only your kogari that you eat. You can cut your vegetables, you boil your beans and strain, you do a stir fry, that is beans and then your vegetables. You can do vegetable rice with beans and vegetables, which will not contain any meat or fish or anything, and will still be healthy. So we have to take our mindset from the breakfasts, tea and bread and those things, and look at some of our local affordable ingredients that are even more nutritious. Because if you compare something like lettuce to ayoyo, lettuce may not fall anywhere close to ayoyo because of the nutrient content, but then people will be eating that rather than what is available. So we should take our minds off the current norm and look back at what we used to eat in the olden days, and we see that we had something better than what we are even feeding on, and it's even more affordable. So that's what I can say.
Thank you.
Thank you, RD Ernestina. We have about 10 minutes to wrap up today's session. So if you have any burning questions or comments, kindly place in the chat box or raise your hand. At this juncture, I'd like to invite Madam Ruby to share her thoughts with us. Over to you, Madam Ruby.
Hello, thank you so much. And RD Ernestina, it was a very good presentation and discussion. I really love the way you went about the talk presentation and the way you answered questions, just as Prof said. And then also, I wish I had spoken before Prof, because Prof has said everything that I wanted to say, but I'll still go on and say what I wanted to say a bit more. I realized from what RD Ernestina also presented, the presentation questions coming, I realized that we need to do more education. I know a lot of dietitians and nutritionists go on TVs and the radio stations to do talks, but I think that we should take, if we take, for instance, one topic such as diabetes, we can just go through this talk for about 3 months, talking about diabetes, how it's diagnosed, how we get it, and go through the medications, exercise, the diet, so that we stretch it. Because as Prof said, there's so much ignorance. I really need to teach to educate them, to teach them. They know there's so much information on the internet, but then we also need to let them know, as already an dietitian will give you the finer details. But on the TV stations and the radios, you can do a bit more. But when it comes to individual one, of course, that will be in the clinic and when we meet them. But on the general viewpoint, we can do so much for our patients and our clients and the general public. So I've lined such a program where we can do this honestly. So if we are looking for sponsorship, so if we have any organization which would like to sponsor such a program, so we take diabetes, we can stretch for about 3 months and go through it, go on with hypertension, stretch it over, and have genuine discussions so that our clients and the public can really understand us. I think it's really helpful. And thank you, moderator, for doing such a wonderful work. Thank you so much. Thank you. Over.
Thank you, Madam Ruby. Thank you. We have some few minutes to go. a question just dropped here. It's a common observation currently that our fruits and vegetables get spoiled or rot within a few days, even when we keep them in the fridge. What's responsible for this phenomena and what can be done about it? RD and Estina.
So I'm not an agric expert, but I think one of those things could be the weather. I mean, the weather is becoming warmer, so spoilage will also go up. So it may not just be because they have other chemicals. It could just be the heat. It is warm. So what we can do is that, I mean, before you buy and put in your fridge, it's been outside in the sun for a while before you did it. So its spoilage has already started. I think one thing we have to do is that the ones that we can prep, some fruits, some can be frozen, some can be cut up and frozen and used later, some can be prepared and then put in bags that can be eaten. And then if you know it is spoiling, then don't also overbuy. I know it's good to buy in bulk, but it will be sad to buy and then get them spoiled. So buy if it's for a week that and when you buy it doesn't spoil, do it for a week so that the perishable things buy for the week, the ones that will stay longer you buy for the month, and that's where you'll be saving yourself money because fruits are not cheap, and if it spoils it's quite painful. So you could do weekly for your perishables and then monthly for the ones that will last, and then let's see how it helps you.
All right. Great. It's been an awesome session. Very, very great presentation. Very great questions and discussions, contributions and comments. All too soon, we have come to the end of today's talk. I'd like to thank RD and Estina for her time, for her presentation, and for the responses to the question. I would want to hand over to Gand, ask if Gand, there's any executive that's on the call, a word from Gand, any executive on the call to share a word or two with us. Maxwell, kindly be on standby. Any word from you two before we finally go off? All right, so let's keep the conversations going on. Let's keep the news going on, the discussions back in our offices, back in our homes. Kindly contact Gand and ask your questions. When you watch the webinars and you have any questions, you can leave it there in the chat. And then we will continue next week. Next week, we will have another session as we have had today. So until we meet again, thank you very much for joining and see you in our next webinar. Bye.
Hello, Joanna.
Hello, Maxwell.
Can you hear me? Thank you
Yes, I
so much.
can.
That was a powerful moderation. You're a very good moderator. We really enjoyed
Great.
the control.
Thank you. Thanks for the opportunity to do that.
Thank you so much.
Yeah.
I think the message is clear.
Yeah.
It's for all of yours that, I mean, people are interested in the topic. So
Exactly.
all right. So I'll catch you up back though. Thank you so much. Thank you.
All right. Thank you, Maxwell. All right.